Vicki, thank you so much for inviting me. It's such a privilege to be part of the Sedona Center. You've adapted to some very challenging situations and times, and you've done it really well. And I'm really very grateful for this opportunity to present today. Some stories about people that have really inspired me in my life and have taught me that if we attribute meaning to suffering, no matter how severe the suffering is, then we can take the bitter lemons and turn them into lemonade. So in COVID, I know during these times, lots of people are doing that in very innovative ways and reaching new heights of post-traumatic strength, or post-traumatic growth as it's sometimes called. So first of all, I'd like to dedicate this talk to 5 people that have been a great influence on me in my faith and belief that this is possible. It's not just theoretical. So one of them is you, Vicki, because you went through a lot of loss and change in your life, and you established the Runaway Husband movement, which is international, and you've written many, many books on helping people cope post-separation and divorce. So you are one of the compendium of heroines and heroes. And so I really want to dedicate part of this talk to you and some of the other people, which I'll mention. And one of them is Angeliki Saranis. So Angeliki Saranis is a social worker at the Children's Hospital, and she had been working for many, many years in the trauma unit. So she dealt with neurotraumas and many, many traumas due to automobile accidents. And she was compassionate from the get-go. I mean, Angelique was incredibly strong. When we were on call and we're dealing with lots of traumatic situations, sometimes impairment, cognitive impairment, death, and having to help the victims and the families. We were so glad that Angelique was there on a Monday morning and would take over the portfolios, because she was really an expert. So when I came back from holiday one Sunday night, I was really dismayed to find out that over the weekend, Angeliki had lost her own very cherished and beloved son in an automobile accident. And she had been so proud of him. She talked about him very, very often. Needless to say, we wondered if she would exempt herself, understandably, from her role in helping others with this tragedy. It would have been justifiable. But instead of doing that, Angelique went on to help even more patients and to become the president of the Canadian chapter of MAD, Mothers Against Drunken Drivers. She fulfilled her term and did so many speaking engagements and fundraisers and campaigning and making this the insurances against other people going through the tragedy that she went through, making this policy, and really, really a great advocate. And she's still involved, even when she completed her term. So I take my my hat off to Angeliki. You're really an inspiration. The other person is Twinkle Rudberg. Over the years, I've referred many youth to an organization called LOVE, which is Leave Out Violence. And it was started in 1993 by Twinkle, who in 1972, she lost her husband, Daniel, when he was stabbed to death by a 14-year-old because he had cornered the 14-year-old after the 14-year-old was trying to steal a purse from an elderly person. And Daniel intervened and lost his life as a result. They'd had a really good marriage, a really good family life, and Twinkle was extremely angry and couldn't understand what would drive a youth to commit such a heinous crime. And she did a lot of research, and actually, not surprisingly, many of the youth who are perpetrators of violence were themselves victims of severe bullying, of witnessing conjugal violence, of sexual abuse, physical abuse, neglect. And she felt that she had to do a repair job. And by doing a repair job in this area, she would be also repairing herself, which is pretty much always the case. And she established this wonderful organization, which gives artistic license and artistic equipment to young people who are witnesses of violence, victims of violence, and perpetrators of violence. And they work together and they do speaking engagements and travel and try to convince other youth to take a different path in life. That violence, even though it's glorified in our media sometimes and in certain, artistic products and whatever, it is not cool. So she did a wonderful thing, and her organization continues, and it's in more than a few cities now. It started in Montreal in 1993, and she was the founder and president. So Twinkle, I take my hat off to you. Another person that had a very big direct influence on my life was Susan Saros. Susan was the director of the Montreal Gestalt Institute, where I studied as a student, and I was trained as a psychotherapist by her. Susan was, and remains, she passed away, I guess more than a decade ago, but she's very much alive to me. She was extremely charismatic, extremely strong, had a tremendous work ethic, and was also so intuitive and compassionate. And she really survived, more than survived. She flourished in terms of helping others. For herself, it was just, it's really a miracle, because, whatever pain she went through, because she was incarcerated in a concentration camp, whatever pain she went through, she used to dig deep and to find the compassion to join with other people's pain. And you really felt she was there with you. People relived traumas at the Gestalt Center, and they were greatly aided by her presence and by her nurturance. When Susan was 15, she was in the concentration camp. She'd come from Hungary. She lost most of her family, and she was only kept alive because she was exploited and abused in really terrifying ways on a daily basis. And this great lady went on to help so many others when another person might have become embittered. So Susan, you are definitely one of the heroines of my life. And another one, a hero, is Lanny Beckman. So Lanny was the founder of the Mental Patients Association of Vancouver, which is really an icon in mental health delivery. Lanny was a psychology student, a brilliant one, and he had a nervous breakdown. He had mental health problems, and he was in a day program in Vancouver. And he found that the system was really helpful from Monday to Friday from 9 to 5. But he said, let's face it, like, people have their crises usually at night or on the weekends. And that's not when the system is up and running usually. So he put an ad in the Vancouver Sun, as I understand it. And he said, if people need more support than they can get between 9 and 5 Monday to Friday, perhaps they can meet with me at this address and brainstorm. And I heard, if this is correct, that about 75 people showed up. And from that group of people that had had mental breakdowns or mental health problems, they developed an idea that they would have a drop-in center where people could get support and help each other, peer support. They ended up having 5 group homes and a newspaper called In a Nutshell. And I was one of the people lucky enough to be hired and fired every 6 months, as was their policy, by the mental patients who really ran the show. And this power reversal was so successful that the recidivism rate was, I think, 12% compared to 60% of the general population of mental patients. Only 12% returned to hospital during a 5-year study. And when they went back, they only went back for 3 days rather than 3 months. This model influenced my entire career, because having worked on the other side, like in the institutions, and even though I was on call, I worked also 9 to 5 pretty well. Not maybe 9 to 7, but I worked, fairly long hours during the week, but I understood that crises happen at night and on the weekends. So I really think that this is a great model of mental health delivery. And I had some inspiration too, because in 1989, in terms of my own life, in terms of feeling that I had to attach meaning to suffering, because In 1989, I was on my way to meet my husband, who was a master swimmer. And in front of the athletic complex, there's a little crosswalk. There was a cement meridian, and then there was a space with a crosswalk. And I started to walk across the street. And I had judiciously looked to the left, and there was nothing coming as far as I saw. There was a curve in the road, but nothing, I could see beyond the curve, so I thought, and there was nothing coming. And actually, as I was walking, I was hit at full impact by a very large motorcycle. I was catapulted literally up in the air, and I landed on my left side of my body, resulting in 5 severe pelvic fractures, left arm that was completely crushed, and several broken ribs. I had a lot of time in the hospital when I was immobilized because they weren't sure if the fractures were stable or not. So I didn't know if I'd be able to walk or if, surgery was possible. So it was a long time that I was in the hospital, but I was immobilized for many, many days. And I had a chance to review the accident. And I said to my husband, I really did look. And I think there's something terribly wrong with this intersection. And he called the traffic and circulation department. I thought they must have those statistics. And I found out that I was the 97th person in under 3 years to be hit at that very spot. The next day, the physiotherapist came to say, you're going to atrophy. Your brakes are stable enough. They're severe, but they're stable so that you're going to have to start to move. And that seemed absolutely impossible. There was a tremendous amount of pain, and my leg felt like it was a cement slab. I mean, just lifting it for a centimeter seemed like a Herculean effort. I just didn't know how I was going to get it up more than a centimeter from the floor. And I actually passed out that first time. Anyway, she came again the next day and she said, you're going to atrophy unless you do this, and we're just going to have to find a way. And I just thought of those 97 people, handicapped or killed or whatever, the statistics under 3 years. And I thought, I got to get out of here. Now, I had been given a 12-month release from work, and I ended up going back after 3 months, actually, because that, the push to do something. I mean, I figured that's every 11 days that somebody's hurt over here. And I'm going to lie in hospital and do the physio and the rehabilitation, which of course I did do. But, it was intolerable to me that something had to be done about this, right? So it really mobilized me to get better faster and to push through the pain. It was considerable pain in the rehabilitation, but I was able to push through the pain because I had a goal, and the goal was to lobby with the people that were handicapped or their families, families of people who had lost their lives there, to mobilize to get something going on that intersection. And in fact, a light did go in May. The accident was in October. And I say, if this had to happen, if I had to go through these multiple fractures and multiple traumas, then almost lose my life. It was really quite a miracle I didn't. But this is what got me through. And I guess the message here is what Viktor Frankl wrote about in Man's Search for Meaning in his book about logotherapy, as he called it, the therapy of purpose, is that any crisis, any limitation that has meaning can end up being sometimes a blessing, but you don't want to say to people, oh, it's a blessing that you had this accident because now there's a light over there, or like it's not consoling to say to somebody who's suffering this kind of level of pain and stress. But ultimately, if it isn't, if you can't see it as a blessing, then it's at least something that we can make some lemonade out of. Bitter lemons that we make lemonade out of. And that's really sometimes hard to see at the time when we're feeling devastated by loss, by pain. So in terms of attributing meaning to the suffering, with the COVID crisis, there's so many wonderful things that people can do to volunteer their time. There's a lot of parents that are at home trying to do homeschooling at the same time as working. They have young children, and I know somebody was telling me they were climbing the walls, literally. They didn't have their kids at home. They were grown, and they weren't working. And so I was thinking, they are an amazing retired teacher and a great resource. And maybe they could, volunteer to do some mentoring or tutoring with some kids that are trying to do the homeschooling. There's a lot of funny videos out there about parents that are trying to multitask and work and homeschool. And it's not an easy task. So, I mean, there's just so many different ways people can volunteer during this time. So I'm thinking that does, make it a meaningful time instead of a climbing the walls time. And, I'm sure everybody's had this idea already, so I'm not, it's not rocket science, but there's lots of ways of attributing meaning to this forced isolation. So just to go on with the attribution idea that if the suffering has purpose and meaning, then it's tolerable. And even more than tolerable, it can actually lead to post-traumatic strength or post-traumatic growth. But there's other factors as well that make people more vulnerable, and those are factors that contribute to the post-traumatic stress syndrome, or sometimes it's not quite post-traumatic stress because it doesn't qualify with the new diagnostic manual's description of PTSD. It could be acute stress disorder or adjustment disorder. In other words, symptoms that persist. Sometimes they consist of being hypervigilant, being easily angered, being, having what's called hyperarousal, which is similar to hypervigilance. So it's being in a state of distress, heart palpitations, if people are triggered. So if they hear a sound or see somebody that reminds them of the traumatic event or events in their life, whether they happened in their childhood or adult life, then they have a hyperarousal. They have more cortisol in their system, more adrenaline, noradrenaline, or as it's sometimes called epinephrine and norepinephrine. So they have the fight or flight mechanism, and it kicks in sometimes very frequently when there's only an imagined threat and not a real threat. And sometimes I tell clients that if they say, in terms of genetics, they can say sometimes that, my whole family and going back, we are not only because we've been victims of, persecution, and the ones who are very, very alert and very on guard, perhaps they survived. And so, we have generations of people that have, this anxiety, but it served a purpose, so there's all these explanations, but there's also the genetic explanation that some people just have a more sensitive arousal system for perceived or real threat. So whether it's a cardiovascular response or whether it's hormonal response or both, they often go together, usually go together. There are some people who have a very sensitive mechanism for responding to real or perceived threat. And so what I sometimes tell clients, it's perhaps your ancestor or you were the person in the tower of the castle, and you were in the watchtower, and you had to look out and see if the mist on the horizon line was really mist or if it was an invading army. And then it was your job to sound the bugle and to alert the army that was living in the castle to lower the drawbridge and charge. And then at the same time, you would evacuate the people that lived in back of the castle in the feudal system, let's say. And sometimes you saw that it was quite a dense fog, but it could have been an invading army. And so you sounded the bugle, and the drawbridge went down and the soldiers went out. And as they got closer and closer to the horizon line, they might have thought, oh my gosh, this is not an army. This is just mist, and it's clearing and the sun is coming out. And so much ado about nothing, but they were relieved, and then they came back, sometimes quite exhausted. And they came back, and then, it was a false alarm, and life went back to normal. And sometimes they were only a little bit out of the drawbridge when the guards person in the watchtower knew that this was a false alarm, because the sun came out rather quickly and the mist subsided rather quickly. And they were able to tell the army, don't waste your energy, just come back on in. This is a false alarm. And so there was less of an expense of energy and more vitality for other endeavors, rather than fighting what ended up just being mist and fog. So living with the uncertainty of the COVID, we don't know what is mist and fog and what is a real danger. Like, we have some ideas that there is a real danger for sure. And in terms of the magnitude and the duration of the danger, there's a lot of uncertainty. So we have to live with this readiness, how to fight it. We have to fight this. We also have to take flight by evacuating, so to speak. So for certain vulnerable populations, it's quarantine and isolation, more or less, within reason. But we don't know the duration, and we don't know the intensity. So we have to try to preserve the energy, because adrenaline, noradrenaline, epinephrine, norepinephrine, and cortisol are very useful in terms of fight and flight mechanism. But if we're constantly in fight or flight mode, it's really exhausting, and we're going to waste a lot of energy worrying about, am I going to die? Am I going to get really, really sick? Am I going to never have a job again? Am I going to, there's all these what ifs, and a lot of catastrophizing that can go on. And what if you're not going to get the COVID? And what if you're going to have work? It might be in a different form, but you're going to have some kind of employment. So you want to conserve your energy and try to think positive. So genetics plays a role, but just by changing our thoughts about it and figuring out ways of conserving energy and tricking the fight and flight mechanism so that it's not always on, we can fight the catastrophizing. So there's different ways of doing it. I was lucky enough to have some trainings with people that worked with first responders and people who had some very difficult missions, who worked with people that had to, not only first responders, but other people that had to put their lives basically at risk in terms of helping and protecting society. And one of the things they said is, of course, we can do what psychologists, call the systematic desensitization. So imagine the danger and then do the relaxation and imagining a safe place and the breathing exercises and all that. And this is very useful, and I do that in my practice with clients. But there's some quick ways too. So if you're in an undercover mission and you don't have time to go through all the steps of systematic desensitization to what we call the noxious idea or stimulus, like I could die here, that kind of thinking, then these psychologists that work with this population have often prescribed smiling from ear to ear, not just a sardonic grin, but a really big smile. And you keep that for 60 seconds. And instead of, I am risking my life in this mission, you can think that, but you're not going to be able to feel bad at the same time, because the whole idea of multitasking is really a fallacy. You can't really do two things at the same time. So if you smile, and when, Mr. Worry, as I tell the children clients, that when Mr. Worry wants to rent a room in your hotel over there, and you want to tell him that there's no vacancies, so you really want to chase him out. This is one way to do it. It's the quick way. So if you have to do this every hour or just when the worrying gets really intense, it's a quick way to do it. The other thing that the psychologists that worked with the first responders were sharing with me is that if people do jumping jacks, so if you don't have knee or back problems, you could do jumping jacks. Some people find it easier to just skip without the rope, for 50 rounds. So let's say 50 seconds. So if you do that, then in studies where the participants' saliva or blood was taken for 75 full minutes after a set of 50, they had reduced cortisol and they had benefits. Okay, so more dopamine, they were more relaxed, they were more positive. So if sometimes I tell students before an exam or another trial to do the jumping jacks and to do the smiling, and there's a lot of quick ways, and there's some more elaborate ways too, which I do in the therapy sessions, to try to get people to lower the cortisol levels. Now, when you're dreaming during REM sleep, which is the rapid eye movement, the dream part of the cycle, your cortisol is lowered. So you can dream about really disturbing things. Now, it's true that some people wake up with nightmares and night terrors, but you can dream about, for the most part, disturbing themes and work out emotional problems with a lower cortisol level. So there's a lot of processing that goes on with the rapid eye movement during dreaming. And even if you don't remember your dreams, it's important to have them. So sleep during this time, and I know I sound like this is very cliche. By this time, you've probably heard this a million times from a million people, but sleep is extremely important. And I know this is a time, because of the uncertainty, that people are not sleeping as well overall, or their sleep is erratic, and there's many reasons for that. And there's a lot of good sleep hygiene tapes, and there's a really, really good book I just read by Dr. Walker of Harvard called Why We Sleep and Dream. And it's important to, even if you don't remember your dreams, to have this sleep. So you probably have all heard it before, but no caffeinated beverages or chocolate about 5 or 6 hours before you're going to sleep. All electronics have to be shut down. And if it's possible to get the black, the dark curtains or the black eye covers to completely block out any light, even bits of street light that comes in through the blinds or curtains should be blocked out, because it's very, very important to allow the pineal gland to release the melatonin that allows us to sleep and dream. And even during the non-REM time, the non-dream time, it's very important to have this time, because this is the time that our brain is sorting out new material. So it's organizing new material. So there's a lot on sleep hygiene. I don't want to take too much time going into it, but it's very, very important for maintaining our strength, our post-traumatic strength, or our going through a challenging time with good sleep. So the other thing that, besides genetics and lowering the cortisol and adrenaline, if that's a problem, is the other factor is people's upbringing. People's upbringing is very, very important. So I have a lot of people that say, I'm volunteering, I'm finding purpose in the pain, I'm doing altruistic things, but I'm having flashbacks because being trapped in the house or feeling abandoned, which I know I'm not really abandoned, but I'm not seeing my loved ones as much. I'm reminded about some of the isolation and breaks in my family, being abandoned, having attachment disruptions in my childhood, or being trapped, or feeling that the government is, is enforcing things for our own good. I know it's for our own good, but I'm feeling, oppressed. So sometimes these thoughts and feelings, even though they may not be rational, they bring up problems that we had in our upbringing. So especially with being securely attached to caregivers that we trust, that don't mistreat us, that are there for us, that are nourishing and mentor us, and having the support that we need to go through the trials and tribulations of life that everybody has. So when there is problems in upbringing, whether it's neglect or abuse, and whether it's, on a couple of times in someone's life, or whether it's more what we call complex trauma, and that it's an ongoing situation, an ongoing family situation, or an ongoing bullying situation, because sometimes people have, fairly good family support, but there's something in the school or the community that's they're not completely open about, and sometimes it really can leave a lot of scars, particularly a chronic bullying situation. And so when people have this type of trauma, my modality is EMDR to help them through it, which is eye movement desensitization reprocessing. And rather than go through a big, long description of this, people can go on EMDR Canada and see a very good description of this. And trauma-based CBT is also useful. And there's many other ways of treating trauma, including some of the creative arts therapy. But when it's an upbringing situation, it's very, very important to know that how this, what we're going through today, is different from what we went through when we were younger. And what I do with clients is, a lot of clients are missing figures in their childhood of comfort, support, protection, and also wisdom. So they weren't mentored; they had to figure out everything themselves. And so, in this crisis, where sometimes they're cut off to some degree from their support system, from some of the mentors that they have, maybe their contact is not as frequent. It's very important for them to reach out and to get help and to get support, and to feel that they're not abandoned, and not to be paralyzed by drawing analogies to early childhood traumas. But at the same time, it's important to treat these early childhood traumas, because like Laura Parnell says, that if you're missing in your life, in your childhood, in your upbringing, figures of consistent support, consistent nurturing, protection, and mentoring, and this doesn't have to be parents. This could be your friend's parents. It could be a teacher that took a great interest in you. It could be a coach. There's a lot of different people, caregivers, that can, fit that bill, as long as they're consistent, reliable, and trustworthy. But if people are missing this growing up, then there are ways of imagining this, and as we call, installing that resource as an adult. So when we do processing of childhood trauma work, what we do in preparation to prepare and stabilize the client for this work is to imagine and install images and feelings of being nurtured, protected, and mentored in ways that maybe we're missing in childhood. So I do this with visualization and repeat this many, many times. So we call getting somebody, as Laura Parnell says in many publications she's an EMDR therapist who's just a fantastic trainer. And as she says, you have to install these resources so that you can talk about trauma with other people and think about it, but feel at the same time that you're held and understood. And so it could be a spiritual entity that you imagine. It could be a wonderful pet that you had or that you encountered, or somebody's great pet that's the protector. It could be, I know in my case, when I was in the hospital and I had to, move through the pain and mobilize myself, I imagined a giant polar bear. It just came to mind. I embodied the idea of this gigantic, strong, fierce polar bear that gave me the strength to mobilize my limbs. I had 5 pelvic fractures. It was very, very painful, but I was able to mobilize my my body with the spontaneous image that came to mind. So whatever it is, it's very important to install the image of this. So I have people do, very deep breathing and deep relaxing exercises. For those of you who do yoga, it comes very easily. Otherwise, I walk them through these relaxation exercises in terms of breathing and body movements. And then we imagine being in a very beautiful place. Sometimes I imagine that they're in an elevator going down and more relaxed, or at the top of a big spiral staircase going down and around and in a beautiful resort. And then they get to the lower lobby and they go out the door into a beautiful garden, and there's a path, and they take the path down to the sea, and they sit in a gazebo or on a bench and looking out at the ocean. Of course, we do this very slowly, and they imagine the sounds and the colors with vivid detail, their surroundings, and they completely relax by this point. And then they just imagine their symbols of wisdom and protection and comfort. It's very, very important to install that before talking about the early trauma, which is affecting their present functioning. So we are often paralyzed, thinking, I can't cope, this is overwhelming, there's nobody there for me, I'm totally alone. And this, we really have to examine where this is coming from, where this thinking is coming from, and when people first began to feel that way or think that way, and then going back into those specific incidents and then reworking them with these figures of comfort and protection and wisdom, and finding the inner resources of the person to move them through and out of these previous traumas so that they can cope with more faith and hope and confidence with the present challenges. And in terms of present challenges, stress is good. Hans Selye talked about that. He's a very good researcher and wrote a book, I think, called Stress and Distress, Stress or Distress. So distress over time, we talked about, is the exhaustion and the depletion of that, and the paralysis of that. So ongoing distress, because problems are just too great for the resources we have, and there's no mitigation. So that kind of distress ongoing is destructive to us. And we really need help outside of ourselves. We have to reach out and get some help for that. But stress, which is not distress, it's just challenge and difficulty in getting out of our comfort zone and having to innovate and do new things and do them in a new way. And we may not be so good at them, and we have to master a new skill, and we struggle. And that kind of struggle is actually good. We're not meant to be lounge lizards, I like to say. We're not meant to live a life without struggle, because if everything is easy, after all, as Maslow says in his hierarchy of needs, once you have your food and shelter and your basic security, and once you have the 4 A's he talks about from other people that we all need: appreciation, affirmation, I think acknowledgement, and affiliation with a group. So once we have those needs met, we still have this push towards self-actualization, actualizing our altruistic tendencies, actualizing our creative gifts. We still have this push to do that. And in order to do that, there's a struggle, because it's not always easy. We have to break new ground to accomplish new feats. So I know I had to move into a more electronic mode of doing my work, and that's been my challenge. And but this kind of stress, we have to tolerate, and we have to move through it. So just to remember that stress is not a bad thing. It's not going to hurt you. It's going to help you. So we can't have a life without struggle and stress. So that's a given. But ongoing distress is not good for us, and we have to reach out for help if we're experiencing that. The other thing that's very important is the social support. So interpersonal therapists say that depression can come about if there's a lack of life events, enough life events, just a full life of some way, like a life that has things to look forward to, things to do, places to go, people to meet. Now it's online, but that's okay. So we have to have life events, We also have to be able to tolerate role loss and role transition and role conflict. And there's a lot of that with the COVID. There's a lot of role transition. We're not working in the same way. We have to be able to tolerate the stress of making the transition to work in a new way, to meet our families in a new way and our friends in a new way. Role loss, a lot of people that were, let's say, grandparenting, taking care of kids a few days a week, and they're not able to see their grandkids now. They have to deal with that and maybe make themselves useful volunteering in some other way with their own or other people's kids or whatever. So they have to be able to substitute what their loss is. They have to also, with role conflict, they have to resolve that. Like families, there's a lot online about helping couples adapt and such. So who are, cocooning. So there has to be family meetings, I think weekly, and who's doing what, when, and how. So there isn't, people taking for granted that you're just going to do that and I'm going to do that and I'm going to have my time alone and we're going to have our time together. I think people have to really talk it out and plan it, and it has to be organized so things don't get chaotic and expectations are not dashed of what we expect our family members during this time. So we have to be able to have the social support, and especially in terms of people who have lack of life events, who are isolated and don't have things on their schedule or something to look forward to. We all need that. So that's a very important step in resilience. So having said that, it's in a nutshell, I think that this is a fertile time for innovation and a fertile time for digging deep and finding new skills and abilities within ourselves and our families, and also a time to reach out. I know for me, I've really enjoyed reconnecting with people I haven't seen or spoken to for a very long time, and getting off the treadmill, sometimes of life a little bit, maybe slowing things down a little bit. So it's been, in that way, trying to make some lemonade out of the lemons, and I hope you can too. And it's really been a pleasure. So thanks, Vicki, again for the opportunity, and perhaps we'll do this again. Thanks, and have a great rest of the challenge. Bye-bye.